Wow, thank you all for being here. I really appreciate it. And we've got some great friends over here to my right that you're going to hear from words from in just a few minutes. I appreciate you being here this morning, or this afternoon rather. I'm glad that I've got so many members of the private sector task force with us today that are going to be able to shed some light on what they've done and the programs that they put in place. As many of you know, in March of 2020, none of us knew what toll this pandemic would take on the world, especially on the state of Nevada. We were deeply affected, but for all that we suffered, we had a distinct advantage over other states in tackling our needs and shoring up our resources. Our business community and partners that you see here in the private sector is an advantage that Nevada has that no one else did, and they really stepped up in a time of need. When I first called Jim Murren to ask him for help to chair a private sector task force, he did not hesitate 1 minute to hit the ground running, and he quickly assembled a diverse group of individuals that you see here and community leaders, all of whom were just looking for ways that they could help us. Today they will present their report on their activities since they first formed, that over a year ago, in a spirit not only of transparency, but also to celebrate their tremendous accomplishments and to express thanks to the hundreds of members of our community who stepped up along the way to help us. They gave donations, some as small as $5, others as large as $1 million, over $1 million. Some provided their professional expertise pro bono. Some handed out masks to those in need. Some donated laptops to our school kids so they continued learning while at home. They all found a different niche that they could help us with, and selflessly they contributed in ways that I can never thank them enough for what they did. It's made a tremendous difference in our fight against COVID-19, and I am incredibly grateful for the work that they did and how they saved the state of Nevada. I'm proud of our state, its leaders, and all its residents for showing the power of public-private partnerships and the strength and resilience of all Nevadans. And I would like to invite now my friend and the chair of the task force, Jim Murren, up to say a few words. Jim.
Well, good afternoon, and how good is it to hug somebody? Anybody, especially the governor of the great state of Nevada. Thank you all for coming here. It seems like so long ago that we were in a situation that we could never have imagined finding ourselves in. We were scared. We felt helpless. We felt hopeless. We didn't really quite know what this pandemic would do, and more importantly, we didn't know how we would survive, what we would do for ourselves and for our families. It's times like this where I'm incredibly proud to be a Nevadan. For you see, I've been through a crisis before, actually more than one. And every time we have faced a challenge as a state, the men and women of our state have risen to that challenge, whether it was 9/11 or the Great Recession or the horror of 1 October, or most recently, this pandemic. Each time in those dark days, we wondered how our state would pull itself through, how we would get to the other side. And each time, we did so with courage and dignity and a sense of purpose, working together as the private sector and the public sector. So it was with that confidence and that experience that I worked with the governor well over a year ago. I knew we would get through this. I didn't know exactly how or when, but I knew we would because we'd done it before. When the governor said, Jim, we'd like to get together with a private sector group, maybe put some men and women together to find resources, to reach throughout the globe, to find people to help us in our small state, it was a call that I was honored to take. And I have to credit MGM Resorts for allowing me to leave a bit early to do that. I was going to retire about a year later than I did, but when this came up, I felt strongly that I could be better served to do so for the state, and MGM, as always, in my entire life with it since I met Mr. Krikorian so many decades ago was there to help the state and allow me to do what I wanted to do. And we assembled this group of people, these men and women, these heroes of Nevada, who gave themselves thanklessly and tirelessly and completely to help us get through this. What did we need right away? Do you recall the fear that we all had? We did not have personal protective equipment. We did not have the basic equipment to keep our first responders, our medical professionals, the people in the grocery stores, the men and women that were working on the resort corridor and everywhere in the valley. We did not have that basic equipment to keep people safe. And how could we get it? Because the small state of Nevada was up against big states like California and New York, Texas, with big budgets. They were paying too much for PPE. They didn't care where they got it. They didn't even know if it was going to be legitimate or not. What was a little state like Nevada going to do in a situation like that? And it was with the courage and the generosity of the resort community, Wynn Resorts, MGM Resorts, Caesars, Stations, Boyd, and every single gaming company, along with Nevada Energy, Nevada Gold Mines, and every other large employer, global companies said, we can do better. We're going to reach out to China, we're going to reach out to Japan, to Europe. We're going to help you find that PPE. We're going to help you procure it. We're going to make sure it's legitimate and safe and authentic. We're going to make sure you don't overpay for it. You're not going to get gouged. We're going to help you get it here. I remember talking to Mr. Adelson, God rest his soul, who gave us planes to go to China to get that PPE back here. Now, isn't that a legacy of an individual? We raised $12 million in a week and a half. I called up, well, that's not bad. I called up the people that always give in this state. Their names are in this report. I said, you've always given before. I hate always going to you for things like this, but when the call was made, they answered the call, and we raised that money. Why was that important? Because the companies that were making that PPE and said, okay, we'll sell it to you, but it's money up front. Got to get the money in front. And if we didn't have that money up front, we would not have gotten that PPE, and we would not have been able to protect the tens of thousands of medical professionals, the hundreds of thousands of first responders, and the men and women of Nevada. Then we had a problem with testing. We could not find an ability to test enough of our people here. Why? Because so much of the testing capacity was out of state. Do you remember this? You'd get a test, it'd be shipped out of state, maybe you'd get it back in 5 days, which, what does that mean? It was worthless. It did not do a thing for you. So we worked with UMC and with Renown and the Nevada State Health Labs. We said, what do you need? They need resources, they need contacts. We helped build a COVID-specific lab at UMC that could test not a couple hundred people a day, but upwards to thousands, tens of thousands of people a week could have been tested and were tested because of that. We realized that we had to find a way to make sure that we could contact trace people, be able to understand if I have this disease, I want to make sure my loved ones and anyone around me, because I'm a human and I care about other humans, knows that they need to figure out where they can get medical treatment. So we called my friend Andrew Pascal, who is a technology genius, and he brought us COVID Trace, which, as you now know, over 1 million people in our state have downloaded and have used in order to check their health status. I got a call not long after that from a woman who needs no introduction in Nevada, who has been there for decades, and of course I'm talking about Elaine Wynn, and she said, Jim, we have a problem. So many of our students here in the state do not have access to the internet. How can we teach our young boys and girls if they cannot even get online? And how do we reach them? How do we know where they are? In the poor rural or urban communities, in the rural communities, how can we find them? And so with Poonam Mathur, who I see over here, and with our superintendent, and with every one of the Public Education Foundation, we got together and we reached out and we connected the entire state of Nevada, every single county in the state in a matter of months, so that no child was disadvantaged by something they had no call over, of course, the pandemic. And the list goes on and on. People donating dollars, tens of dollars, millions of dollars. People reaching out and said, you know what? I have a cosmetics company. I think I can make hand sanitizer. I live in the state. You coached my kid in Little League. I want to help you, Jim. And Merle Norman, Travis Richards, who lives here in town, said, I think I can do it. He gave us gallon after gallon hand sanitizer that we gave away. Do you remember trying to find masks? Trying to find a mask that you could just go to the store and feel good about? The governor said, we need more masks, Jim. And so I reached out to a handful of men and women in our community, including Steve Klubeck, who has been so philanthropic in the past. We bought hundreds of thousands of Nevada state masks, and it was so incredibly heartwarming to see our governor and medical providers and athletes and performers wearing those very masks. It's been a journey over the past year plus, but it has been inspiring to me. As someone who loves this state, I couldn't think of a better thing to do with my time over the past year and a half. And I want to particularly thank my task force members, some of whom are here today. Many of them could not be here, but have sent their love and support, and they're all very appropriately indicated in this report. But I see Scott Nielsen here, who I love, and what you have done with all the professional services that have donated so much of their in-kind work for us. Scott, you shepherded all that. I want to thank you dearly for that on behalf of the state of Nevada. Dr. Rob Macbeth, who has been our medical North Star since we began the task force, who I'm going to ask to speak to in a moment. I see my dear friend Alex Dixon, who has been basically the chief operating officer of this task force, who's kept the wheels on the track, has kept us all working so hard, and as a great loss to our state, is going to be leaving the state of Nevada for a job outside of the state. Boo for that, but we're happy for you and your family, Alex. And all the men and women that have helped us. I thought I'd bring up briefly Dr. Macbeth, just so we can go back in time and remember where we were. Not to scare us, but to maybe send a message. And this would be my party message to you. We can never again, in my opinion, find ourselves in the position we found ourselves in early 2020. We can no longer be dependent on states out of this state for our very safety and our livelihood. We cannot rely on out-of-state medical providers, testing companies, manufacturers, academic institutions in order to give us the vital tools that we need. We're the battle-born state, for God's sakes. We're an independent state. We need to do this here at home, because make no mistake, there'll be another crisis. I've lived through 5. There'll be 5 more before I leave this earth. We cannot find ourselves in the position we found ourselves in early 2020. And we can do that. We've done it before, and we are going to do it now with the efforts of this state to diversify our economy, to bring businesses into our state, to diversify the men and women's jobs, and to be more self-reliant, which is what Nevadans always want to be and have been. So with that, I'm going to bring over Dr. Macbeth, if you can come over for a moment, and please share what your thoughts. Thank you.
Thank you, Jim, and thank you, Governor. Just incredibly proud not only to serve on this task force, but of all of the task force members and the work that they have done over the last year and a half, and all of the supporting people that supported the task force, which are too numerous to count, but just an ongoing incredible effort. Looking back in the early days of March and April of last year, as Jim said, there was true fear in our community, and it extended also to our healthcare providers and first responders. They were faced with the challenge of having to go in and take care of very sick people, but without effective or enough personal protective equipment. And so incredibly grateful for the donors in coming up with the funding to allow us to leverage the contacts that our gaming industry and Jim's team had across the globe to secure the PPE, which was so critically important for our healthcare workforce and first responders to continue to do their jobs in a safe manner. It made a critical difference, and very proud of that effort, and just an enormous debt of gratitude and thank you from all of the healthcare providers in this community and first responders for that effort. Speaking to the testing, Jim is spot on. We had no real capacity to address this pandemic, and the capability that we did have, while the laboratories were local, these tests were done out of state, and the turnaround times were 5 days would be good. It was often much longer than that. And that had a critical impact on just about every facet of the work that we were doing in the healthcare sector. And when we look at establishing the ability to do our own testing at UMC, that was an absolute game changer. It affected patients who still needed to have surgery, still needed to have procedures done. We're able now to be tested with turnaround times as low as 6 hours. It was a phenomenal change in the way we could actually care for people safely in the community. So my message to everyone is just that of a large debt of gratitude for everybody's participation in helping us accomplish these goals. So thank you all very much.
Good afternoon, everyone. My name is Alex Dixon. I humbly serve as a finance chair for the task force. And first, let me thank Jim for what an honor it's been to serve. It's been an absolute pleasure. I'm born and raised here, third generation, and to be able to have an opportunity to serve the state has been just tremendous. Mr. Governor, it has been a tremendous honor to work with your staff. I've known your Chief of Staff, Michelle White, for many years, and she, alongside everyone who serves in your cabinet and in your agencies, has been tremendously helpful. We could not have done it without them. One of the first calls that I made very early on was to Sandra Douglas Morgan, who was the chair of the Gaming Control Board. And I said, Sandra, Jim said we need a place in order for $4 million for PPE out of China on Tuesday. Well, we had our first call on Saturday, and we did not have a dollar raised at that point because we were still within the week and a half. And I said, I'm just a poor boy from the West Side. I don't know what, how we're going to figure this out, but we did, and we did it with the help of the Nevada Community Foundation. We did it with the help of Brownstein. We did it with the help of R&R Partners. Doug Cannon, who is the CEO of NV Energy. You can imagine having a big job like everybody on this task force does, but put together a procurement program that was absolutely tremendous. Later on, we began to work with many others within the community, too many to name, but the Business Information Network, we're joined here by longtime city manager Betsy Fretwell, who has been not only a friend, but has been tremendous throughout this effort. But none of this could be possible without our friends at R&R Partners. They are a true statewide treasure. And we are grateful for the effort of Catherine Cole, who not only sits on the task force with us, but really helps to lead this effort today. And so, in short, we ran this like a business. We ran it with the board, with Robert's Rules of Order, with my fellow task member, Scott Nielsen, who's here today, really helped us put in place a structure to make sure that from a governance standpoint, we could produce what we did today. And Phil Satchery, who's not with us today, but helped to lead our audit committee, ensured that we had the support required to account for the revenues that came in. We're able to demonstrate how those were spent. We're able to let our donors know who, in the middle of the night, in many cases, answered a call to give to an organization that they didn't know about, that didn't quite know exactly what it was going to be, but they believed in us. And we're fellow Nevadans, and we represent the state. And so to be able to have that opportunity, to be able to deliver and come out on the other side and see our hotels active, to see our restaurants active, to see people getting back to work, to see people really being able to have a good understanding of what it means to be Las Vegas is truly a pleasure. And it wouldn't have been possible without our frontline healthcare responders. And first and foremost, that is what we were here to set up to do, is to protect them so that they could protect us. And so on behalf of the task force, on behalf of the many volunteers, I thank you. I thank you, Mr. Governor. I thank you, Jim, for the opportunity to serve, and my fellow task force members. Thank you all. Appreciate it.
And to conclude, I'd love to, if I may, invite the governor up to officially give you our report. Governor, this was a labor of love, a love of the state, a love of the fellow Nevadans that you represent. I'm incredibly proud to be your friend. You have served our state so incredibly well as the CEO of Nevada. And thank you for entrusting with us the responsibility to do what we could to help you. As always, I'm always going to answer your call for whatever you need, because I love the state and I love what you're doing in the state. So thank you very much, Governor. There you go. Thank you.
Thank you. Thank you. You're a good man. Thank you, Jim. Thank you, Jim, Alex, Rob, everybody that spoke. And words can't express my thanks to these individuals here. I'm surprised that Jim's going to continue to answer my calls, because every time I call him, I'm asking for help. But he always answers, and I really, really appreciate that. And when you look back on this, what we went through, I remember the calls I made to Jim and said, we need more masks. And the feeling when those planes landed, McCarran, it provided masks, provided the PPE for our frontline workers that was so desperately needed. It was unbelievable. And every governor, I was on governor calls every single day, was fighting for the same thing. It was $1 for a mask. This would be $2. This was $3.50. It's $6. I mean, prices were spinning out of control. They didn't have a task force like I did, and I'm so eternally and forever grateful for that. All of you that participated in this and stepped up in such an incredible way at every level, whether it was providing tablets, broadband access for our rural communities, for our tribal nations, for our students, making sure that kids had an opportunity, making sure that our frontline workers were taken care of with PPE, making sure that there was food delivered to folks. We faced issues that this task force, with the help of the Nevada National Guard, we could never have imagined getting through it without their help, and I sincerely appreciate it. We are forever grateful, and we're forever better as a state as a result of everything that you all did for us. Before I end, I want to add one more thing here to remind folks that we've made great progress with the help of these individuals from the task force that you see here in fighting this pandemic. But we're nowhere near done. We're nowhere near done. This morning I read the weekly Nevada Hospital Report, which noticed a modest increase. I'm sure you're all well aware of this, in the hospitalizations due to COVID-19. According to the report, the commonality of these hospitalizations is one thing. None of those people were vaccinated. Increase in hospitalizations, none of the people were vaccinated. We can prevent the hospitalizations, and we can certainly prevent the deaths if we just get more people vaccinated. And I beseech my friends, our residents, to go get the shot if you haven't got it yet. If not for yourself, it's for your family. We know that the last year and a half, the effects of this virus have not changed. But our tools for fighting the virus have changed. We have vaccines. They're highly effective at reducing the severity of the cases, the hospitalizations, and ultimately deaths. We started with protocols for social distancing and masks and hand sanitizer. We now have the most effective tool ever, which is vaccines. We need to do more. Our healthcare workers have been on the front line fighting this virus and this pandemic since day one. Since day one, they showed up for work when everyone else didn't know what to do, when we didn't know what to do. They showed up for work and had to use masks over and over because we didn't have enough to these generous folks. Not only did they step up and help, they stepped up and wrote checks. Let me tell you something. The state didn't have $5 million, $12 million to go out and buy things. We didn't have that kind of money. And the state never pays up front, just so you know. We just don't do business that way. So it would have made it impossible for us to go this far. Last week, you all know we announced Vax Nevada Days, our state's incentive program. And I want to encourage everyone to go get vaccinated. You've got a chance to win $1 million. You've got a chance to win a college scholarship if you're a student. Great opportunity there, and more importantly than even the cash prizes and the awards, you're going to protect your health and the life of all Nevadans. So thank you for being here. We have time for some questions, and I want to conclude with, you're my heroes. Thank you. Thank you all.
Come down here first, and then we'll go to you, Mary.
Since mass vaccination centers in Southern Nevada have closed, vaccination rates have lagged. Is there concern that we've moved away from mass vaccination efforts too soon?
Well, we have, and you're welcome to ask questions of any of these folks if you want to call them up there and take me off the hot seat, but I'm happy to answer that question. Obviously, the state relinquished control to the counties in terms of vaccinations and this stuff. We are concerned. We're working as closely as we possibly can with our cities and our counties to make sure that they have the resources necessary to provide vaccines, whether those are in mass sites or drive-up sites or pop-up sites, whatever it might be. We're working with all of the various counties to provide whatever resources they need in order to vaccinate the folks that live in the particular counties. So we will continue to work with them and be available to assist in any way possible.
We'll come Mary for the next question.
Thank you. Governor, is the work of the task force ongoing or is it disbanding? If it is ongoing, what is the current priority?
No, this report kind of wraps up what they did, and I want to say that if you have a chance to look at it, the transparency that you're going to see here is something that we need more of at all levels of government and all levels of public-private partnerships. I mean, everything is available here. They accomplished, what we asked for in terms of procuring the things that we asked for. I mean, well, I didn't ask them to find toilet paper, but I probably should have at the time. But their mission that we put them to is completed.
Do you have any other questions for Gov or members of the task force?
You-
So, is it John and then Channel 8?
Okay. Hey, John.
Governor, what is your confidence level that all the counties are focused on the realities of COVID? Obviously, there are some rural counties in our state that have a very different view of the world.
Really? I haven't seen some. Yeah, there are some rural counties that have been a little more hesitant, a little more resistant. We have tried to work with all 17 counties to explain to them, to provide resources that we have. Some of them are much more resistant and hesitant than others. We're not forcing anyone to get a vaccine. Like I said, we've turned it over to the various counties. Some have been more aggressive than others, but I maintain that we provide any resource or tools that we have to assist them. And I think the best thing that you saw in the hospital report, and I can't stress this enough, the uptick in cases, the uptick in hospitalizations, none of those folks have been vaccinated. I mean, if you want to protect yourself, there's a simple solution. It's go get vaccinated. And I encourage everyone to do that.
We had Channel 8.
Yeah, I was going to say, since there's a banning of that was it for them, is there any processes that you learned from this past, or from the task force that will stay afloat throughout the pandemic?
It's good to have great friends. I learned that. I learned that this community, this state, is the most giving, resilient community that you're ever going to find. I challenge any governor, and I've met every governor in the country, any governor to come up with a group of individuals like this. It's not going to happen. It's just not going to happen. You're not going to have people that just, these are folks that live in Nevada. These are folks that love Nevada. They love this state like I love this state. And I learned that we are a resilient state. We can come back, and we will come back. We're coming back better and stronger than ever before. And I learned that you can't be afraid to ask for help. I asked for help, and I mean, they delivered better than I could ever imagine.
Good, Denise, right?
Governor, is there any data yet to support whether vaccination rates have gone up since you announced these efforts?
No, it's a little too early. You know, I've asked that same question. I'm eager. I hear anecdotal stories that people tell me, or I frankly hear a lot of stories from my kids who tell me that their friends went and got vaccinated because they see cash at the end of the rainbow. So I'm hearing anecdotal stories. It'll be a little time to tell if the numbers are increasing as a result. But every shot that we get in arms, every day that goes by, we're doing more to protect our state and to protect our residents, and I'm thankful for that.
We'll come up here and then we'll end with Mary.
Do we have vaccination rates by occupation or by sector? Specifically retail and restaurants, do you have any data on that? Jim Murray can chime in.
I don't know if anybody has, I do not have data as it relates to job occupations. We have it as it relates to the counties, but not as the job occupations. I know a lot of folks in the resort industry have given me their figures, and when we needed to open up more, we encouraged them to get their folks vaccinated. I can tell you I toured an awful lot of resort hotel sites, casino sites that had vaccination centers on site to help people get vaccinated. I don't know if anybody has any specific data as it relates to that. I don't know.
Work with the Department of Health and Human Services and see what they can provide. That kind of information is self-reported when you get your vaccine, so we can follow up on that. Mary, do you want to take us home to the last question?
Yeah, thank you. Can you clarify what the role of the task force was in building UMC's testing lab and increasing its testing capacity? How did the task force assist that?
Well, I'm going to bring Marcia Turner up here. Come on, you didn't expect to be called.
You drew the short straw, Marcia, sorry.
Governor, can I help on that?
Please, you certainly can, yes.
Yeah. So Marcia didn't expect to be called, but so Mary, thank you for doing that. So, but I saw her in the background, and I wanted to, the former chief operating officer of UMC, so I think you would be the best position to be able to tell us exactly what happened, right, Marcia? Are you okay with doing that? Okay. All right.
So I used to serve as the chief I used to serve as the chief administrative officer for University Medical Center, and you know, when something like this happens, it's all hands on deck. And I had the good fortune to get a phone call from Jim Murray, who asked if the task force could help UMC in developing local, reliable, sufficient testing so that we had enough testing capacity to not have to be sending the tests out of state and have those long delays. That, you know, while you're waiting for a test result, you could potentially be infecting a lot of people. So with the help of Jim and the task force, they helped UMC secure equipment and supplies to be able to go from, it was the end of April in 2020 when Jim called. UMC had the capacity to do 100 tests a day. And in the months following that, they developed a separate, dedicated COVID testing lab that had, I think it was up to 10,000 test a day capacity. And I don't know what the final numbers are, but it is worth looking at to see how many people were tested as a result of Mason Van Helling, the CEO of UMC's commitment, the help of the governor, Richard Whitley, the people at the State Health Lab, Jim and the task force. We were able to develop that local, reliable testing. And then when the economy was reopening, we had special partnerships with the different corporations to help them do the ramp-up testing so that they could have their employees return to work safely. Hopefully that helps.
And I want to add to that. At the beginning with the testing, and they're really understating what they did, we didn't have test tubes. We didn't have swabs. We didn't have the transfer agent that the swab had to go into. We didn't have any of that. They had to go find all of this for us, and then we had to assemble it in order to do tests. I mean, so much has happened since we first began here. Now you can get tests, they're readily available. They weren't at the moment. Now you can buy masks at Walgreens or CVS. I mean, we had people donating. We had construction companies and nail salons donating 6 masks, 12 masks, because they had extras. And that's what we were using for nurses and doctors, is what this community stepped up and donated. It was a remarkable effort, and it's something that people need to recognize. And the other thing, you need to recognize these faces and these names. Words can't express how incredible they were. They answered every call, they answered every challenge, and like I said, they saved an awful lot of lives, a lot of lives. At the very beginning, I had this discussion with my chief of staff. We were worried about legitimately having enough body bags in the state of Nevada. We worried about having body bags. We worried about crematoriums and air quality, how bad it could get here, where they were predicting 30, 40, 50,000 deaths in the state of Nevada. And who do I call for help? The task force. And they were there. So we made it this far, and we're going to make it the rest of the way through this pandemic.
Thank you everyone for coming out. We have some printed copies of the task force report. I will send a press release once I get back upstairs that has a link so you can see it online. And thanks for coming out today.
Thanks.